Mr. Speaker, I rise today to recognize National Rural Health Day and to highlight the work and cause of the Congressional Bipartisan Rural Health Caucus, which I am proud to co-chair with my colleague, Rep. Takuda of Hawaii. Over 60 million hardworking, everyday Americans live in rural communities throughout the United States, and as my co-chair, Rep. Takuda, is fond of citing, with nearly 97% of our nation being designated as rural. Compared to their counterparts living in urban and suburban areas, rural Americans experience lower life expectancy, poorer health status, and more difficulty accessing quality and affordable health care. Rural patients face these challenges due to the limited number of rural health care providers, higher rates of people being underinsured and uninsured, and long journeys to health care providers, sometimes people lacking transportation entirely. And having served as a community pharmacist in rural East Tennessee for over 37 years, I understand the unique healthcare challenges and obstacles faced by our patients and healthcare providers each and every day. It's crucial that Congress takes action to address the issues that rural healthcare providers and patients grapple with, such as workforce shortages, supply scarcities, and reimbursement challenges, limited access to telehealth, and difficulties ensuring their patients receive the care they need. The Congressional Bipartisan Rural Health Caucus is here to provide a forum for members of Congress to advocate for legislative action that will help increase access to quality, affordable health care and mental health services for all rural Americans. As co-chair, I will continue to work to advance the cause of ensuring the long-term sustainability of rural communities. This Congress, I introduced the Bipartisan Rural Physician Workforce Production Act, which improves Medicare reimbursements and enhances the current structure of the Medicare-funded graduate medical education program, bringing more medical residents and doctors to rural areas in need. I also worked with my fellow colleagues in the Tennessee delegation to introduce the Rural American Health Corps Act, which would provide incentives for healthcare professionals to work in rural health facilities in exchange for forgiving medical school loans. In addition to these bills, I'm a proud co-sponsor of the Save Rural Hospitals Act, bipartisan legislation that will aid in curbing hospital closures in rural communities by ensuring fairness in Medicare hospital payments. This legislative work is absolutely critical. And this week, I'm pleased to help introduce with Rep. Takuda and other members of the Rural Health Caucus a resolution supporting the goals and ideals of National Rural Health Day. National Rural Health Day is the third Thursday of every November, and it was established to honor rural communities and the contributions and efforts of rural healthcare providers to address the unique challenges faced by the patients they serve. Given the healthcare disparities faced by rural Americans and the continued difficulty experienced by rural healthcare providers in just keeping their doors open, it's vital that Congress prioritizes improving patient care and access in rural areas. Our rural healthcare professionals and patients showcase a selfless and community-minded spirit, and it's altogether fitting and proper that we celebrate rural healthcare providers and the millions of Americans that rural healthcare providers serve. In recognizing and celebrating National Rural Health Day, we joined a diverse coalition of rural healthcare stakeholders to express a commitment to advancing policies to improve healthcare accessibility and affordability in rural areas in our country. Mr. Speaker, I thank Rep. Takuda and my colleagues for joining in this cause, and with that, I yield back.